I'm Congresswoman Alma Adams. Thank you to the National Eating Disorders Association, NEDA, for hosting today's event. I'm grateful for the work you do day in and day out to raise awareness of the serious mental illness of eating disorders. We're still working hard in Congress to write legislation to mitigate the damage caused by the coronavirus and to help businesses and families get through this national emergency. I know that this time of social isolation and stay at home orders is particularly hard for students and others who are at risk for or battling an eating disorder. And that's why last week I was proud to introduce the Eating Disorders Prevention in Schools Act with my colleague, Congresswoman Vicki Hartzler. We know that students will need eating disorders support in schools across the nation as we work to rebuild and reopen after the pandemic. The Eating Disorder Prevention in Schools Act would help provide that support by encouraging schools to include eating disorder prevention within their local school wellness policies. These policies are used to guide school districts in creating environments that support healthy food habits and physical activities. Now, those policies can also be centered around ways to help prevent disordered eating and improve the overall health outcomes of children. Additionally, the bill would ensure that mental health professionals are included in the development of local school wellness policies. As you all know, eating disorders affect 30 million Americans of all body sizes at some point in their lifetime. And tragically, each month, 1 million children engage in risky behaviors to control their weight. Schools are uniquely positioned to play a part in this increasingly significant public health issue, and the Eating Disorder Prevention in Schools Act helps to ensure they're equipped to do so. Thank you, NEDA, for your support of this important legislation, and to all of the advocates who have already taken the time to reach out to their representatives to encourage them to co-sponsor. I hope that you'll continue to stay safe and healthy during this difficult time. Don't forget, wash your hands, wear a mask, and stay at home as much as possible. I look forward to continuing to work with you to advocate in Congress for those struggling with disordered eating. Thank you all and enjoy the panel.